Good afternoon, everyone. Thank you for joining us for our press conference this afternoon. My name is Matt Lara. I'm a PIO with the City of Austin, and today I am joined by APH Interim Director Adrian Stirrup, Dr. Desmar Walks, Austin Travis County Health Authority, and Cassandra DeLeon, APH Chief Administrative Officer for Disease Prevention and Health Promotion. We'll open it up with some opening remarks from our panels, and then we'll hand it over to our pool reporter from CBS Austin. At this time, I'll hand it over to Dr. Walks.
Good afternoon, everyone. As you know, we are experiencing a surge in our community. We are learning more about the data and the science, and there are new variants in our community. The virus mutates to survive when it infects another person. And as we learn more about how it hurts people, we must adapt to. Based on the latest information about the Delta variant, we will be changing the recommendations for our risk-based guidance stage 5. We have been through surges before, but this surge is by far the fastest and most aggressive that we've seen. Almost all of our hospitalizations are due to unvaccinated patients developing severe illness. ICU staff are seeing a younger population in our hospitals. Patients in the ICU are sicker and staying in the hospital longer than with prior surges, putting more strain on hospital resources. ECMO machines, which are life support machines that are often used as a last resort, are now being used on people as young as 19 years old. These life-supporting machines each require specialized staff and technicians to operate. Staff members that our area hospitals have short supply of. And our Delta variant is putting a strain on the ability for our staff to service the numbers of people that are coming, because it's not that we don't have the beds and the equipment, but we need a certain amount of staff to be able to supply certain types of care. As the Delta variant passes from person to person, it's much, much more aggressive. And it means that we need to be more vigilant about our hygiene practices that we know have worked in the past. Wearing a mask, washing your hands, watching your distance, and staying home when you're sick. So I make a plea to those who are vaccinated in our community, and I want you to know that we all recognize that when we went to get vaccinated, we thought of our loved ones, and we wore a mask until a vaccine was available, but we need to do it again. For those that are fully vaccinated, we need you to wear a mask to protect others. It's possible for you to be asymptomatic and pass this virus that's in your system on to somebody who's unvaccinated or high risk, or a child who's not been vaccinated. We know that this virus grows and mutates in unvaccinated individuals. And while we imagine that an unvaccinated person may be an adult, we also see that we're seeing more pediatric cases, and we're seeing it in children that are younger than 12. And most recently, we're also seeing that children are able to transmit to adults. The vaccine still is very effective at keeping you out of the hospital and out of the ICU. And while the vaccine doesn't make you invincible from the COVID-19 variants, including Delta, getting vaccinated is your best possible defense and significantly reduces your chance of getting extremely sick, being hospitalized, or dying. While you may not need medical care for COVID-19, you may need it for an emergency. And for that, we want to make sure that the hospitals have room should you or a loved one need it. And this is why we are asking you to step up again and decrease the number of cases in our community by taking actions to stop the spread. For unvaccinated populations in our community, and we understand that you have heard stories of patients who asked for the vaccine in the ICU, and at that point it's too late to get the vaccine because people are already sick. But we don't want you to be that person that has to choose a ventilator instead of a vaccine. If you're hesitant and have questions or concerns, don't take them to social media. Talk to your doctor or call the health department or visit reputable medical sites for information. But most of all, our ICU patients are unvaccinated, and we are recommending that you stay home and avoid gatherings and travel, dining and shopping, and instead choose curbside or delivery options. And if you must go out, wear a mask when conducting essential activities. Our businesses are at the core of the success that we've seen in our past surges, and we need your help too. And in recent days, when I've spoken to business leaders, they are up for the challenge once again. We know that there have been struggles in many businesses, and we know that many of these businesses are just getting back on their feet, and we want to keep our business community open and thriving. We are asking that our business leaders require masks of their employees and customers and take action to ensure safe distancing and spacing in business facilities, and to shift back to contactless and curbside service when possible. For additional resources on measures that businesses can take, please go to www.atxrecovers.com. And now to our children. Children under the age of 12 and those with medical conditions are the ones we need to protect by wearing our mask around them. And we need to get vaccinated to protect them. And we need to have as many as who are eligible above the age of 12 and above to be vaccinated. The vaccine for children under 12 is on the way, and we just need to hang on until it arrives. As we enter the school year, we know everyone has concerns. We know masks work. We know this because they worked last school year to keep infection rates in Austin much lower than the community at large. With the first day of school right around the corner, it's crucially important that students wear a mask at school, especially in an elementary school where children are not yet eligible for COVID vaccinations. And this is in accordance and aligned with the CDC guidance and the American Academy of Pediatrics. Every parent, especially a parent of a school-age child, has the right to insist that their child wear a mask at school. If you tell an ISD school that your child should wear a mask, that will be honored, and that child will wear a mask and have a great school year. Our goal is to protect our community's health. We need your help to do that. Get fully vaccinated, wear a mask, watch your distance, wash your hands, and stay home if you're sick. We can do this. We've done it before, and we need to protect our children. Thank you.
And at this time, we'll turn it over to Interim APH Director, Adrienne Stirrup.
Thank you, Matt. Thank you, Dr. Walks, for sharing all of that information. There isn't much more for me to add, but just to reinforce, vaccination is the long game. That's how we protect our children. That's a way that we can establish our legacy. What did we do during the pandemic? The more that people are vaccinated, the less likely we will have to deal with fiercer variants. The way to protect ourselves from this surge is to get community compliance with the recommendations associated with stage 5. We can do this. We know how to be collectively responsible. We are our brother's keeper. Thank you.
And just to kind of wrap in a few items that I think are important, vaccine availability is in abundant supply. We've got vaccine in lots of different locations. Austin Public Health has a lot of vaccine available. We also have our Travis County Collaborative, and they are providing a lot of vaccine across the community. We also have mobile operations. If you are unable to leave your home, or you know of someone who has limitations on getting to a vaccine site, we have vaccine available. In addition to that, there are many providers. So if you're in HEB, if you're in a pharmacy, they've got vaccine. It's an opportunity to get a vaccine. If you're doing your normal shopping, take that vaccine. Unfortunately, because of this surge, we've also had to mobilize testing again. We're seeing lots of needs for testing, and so Austin Public Health has stood up 2 different testing sites. We also have mobile testing. And so if you are feeling ill and you need to, you're considering getting tested, we have those options available for you. Please go ahead and get tested. We do want to advise, if you are sick or you feel like you've been exposed to COVID, it's important that you think about protecting all of the others around you, and you stay home and you follow those protective measures until you get the confirmatory, whether or not the test was negative or positive, and then you follow the appropriate next steps to protect yourself and others. As Adrienne said, Director Stirrup said, and Dr. Walk said, we can get through this. The vaccine is our way out. And this is an important time for us to really think about how we would protect ourselves, protect our family, our children, our mothers, our fathers, our grandparents, and the rest of our community. And with that, I'll open us up for questions.
Thank you very much, Cassie. And at this time, we will turn it over to our poll reporter from CBS Austin. Just as a reminder, we do have a hard stop at 1 o'clock. So if we do not answer your questions, please send them to the media inbox after, and we will get to those. Over to you, Adelia.
Yeah, thank you. And what I'm going to do, just for the other members of the press, I'm just going to go through everybody's first questions first, and then I'll get to second questions if I can. So let's start with Molly Oak with KView. Her question is, current projections show that ICU patients in our area will spike to nearly 300 by the end of the month. How many staffed ICU beds does our area have? Do we have enough beds to handle that potential surge, but not enough staff?
We, at this point, have beds still available, staffed beds, and we are working together in collaboration with our partners to make sure that we take the steps that are needed to have beds available to take care of our patients.
All right, next question, Alejandro Martinez Cabrera from KUT. Are you preparing alternate care sites or any other measures given the possibility of hospitals and ICUs reaching capacity? What level of care can people with non-COVID medical emergencies expect if hospitals and ICUs become saturated? And I guess my addition to that is basically, are we looking at a field hospital at the convention center earlier in the pandemic?
At this point, we have plans, surge plans that include all of those options that have been asked about. And as the situation evolves, we will pull the plan that's appropriate to be a solution for that situation. But our emergency management coordinators from the hospital systems, the county and the city, and CATRAC are minute by minute monitoring the situation and making planning accordingly.
Olivia Aldridge with Community Impact. Are there efforts to recruit more staff to help boost our ICU capacity? Why are hospitals experiencing these staffing shortages?
Yes, there are efforts to recruit more staff. These shortages are occurring because our medical community has been responding to this crisis for the last 19 months, and some people have taken leave, some have retired. This has been a long road of response. And we are putting a call out to our medical society members who are retirees and asking them to step up to help in this situation. And once again, we are having a lot of people heeding that call to come and help. So I'm confident that we as a community will get through this, but it's really important that our community does its part to be vaccinated and to wear masks and to take measures that will decrease the number of cases that are happening each day. We know that if we do those things, we can flatten this curve and we can get to the other side of it.
Nadia Chaudhary of Eder Austin, would the city attempt to pass a vaccination requirement for indoor dining / activities a la New York?
We're looking at all of the options that are available to us to help in this situation. And today we're asking our community to make that personal choice to be vaccinated. And we're asking our business community to stand with us in encouraging and supporting that plea and that call to arms.
Caitlin Carmount of KXAN, will you be involved in approving permits for big events like ACL, and do you anticipate any changes in those processes?
APH works closely with event organizers and historically has done so, and the process will continue as always to address any issues with safety and preserving and protecting the public health. And that will continue in this instance going forward as we respond to this pandemic and move into stage 5.
Rudy Koski of Fox 7, has the authority considered activating the reverse 911 call system on a daily basis, urging vaccination in walk-up locations?
We have used that measure in other instances, and we are still in conversation about the frequency with which to do that. As you know, you lose the effect of something if you do it too frequently. So we're assessing that situation and making some determinations on how to best utilize that service.
Heather Osborne with the Austin American-Statesman. Dr. Wachs, what do you recommend business owners do to help reduce the spread of COVID-19 in the community? Should restaurants, for instance, close up indoor dining? Should shops require masks?
Absolutely requiring and recommending masks is what we would really ask that everybody in our community do. As to vaccinations, we're asking that we urge our patrons and customers to be vaccinated, and businesses can make a personal or a business decision to require vaccinations of their patrons and members. and we would support those that do so.
Betty Cross of Telemundo. Nationally, 12 to 17-year-olds have one of the lowest vaccination rates. Are we seeing this in Austin, and how big is the gap between teens and older age groups?
I'm going to let either Cassie or Adrian answer that question.
We do see that the total eligible population, which includes that 12 year and older population, we're at over 70% first dose, and we're at about 63% second dose fully vaccinated. However, that 12 to 17-year-old population is definitely trailing behind. We are seeing that they're right at about 50% getting that first dose. So this is an important time, particularly as they're planning to go into school, to use this as an opportunity to get them vaccinated so that they're protected. Also thinking about all their other back to school vaccines. This is an important time to use this all of those things can be done at the same time. So as you're thinking about getting your back to school supplies ready, getting your school clothes ready, getting your masks ready, also think about getting that vaccine for those 12 to 17-year-olds.
Carmen Hernandez from Univision. What are local authorities doing to reach communities with low vaccination rates? Is door-to-door working?
We had the opportunity to be in a conversation this morning with the vaccine coordinator for the White House. And what we're seeing nationally is that community-based approaches are making incremental changes with great reward. So while we're not at a point in the pandemic where we're seeing large numbers of folks or large numbers of vaccinations being reported weekly, the measures that we are taking to ensure that our hard-to-reach populations have access and information to help them make good choices will be key. Travis County and Constable George Morales kind of started this charge with canvassing in areas in the Eastern Crescent, and Austin Public Health is going to partner alongside them to augment those areas in the top zip codes that we've identified that need additional help and assistance.
Greg Ciotti of KOOP Radio. Do you expect another surge caused by another mutation beside the Lambda variant? There's also a Colombian strain now active in Florida.
It is possible that we will have another variant that arrives on the scene, but we can make that a different scenario. We can take steps right now to make it so that a variant of COVID-19 is not able to infect someone in our population, and for that variant and the infection in that person be spread to other people. And the way we get that kind of herd immunity is by everyone that's unvaccinated or partially vaccinated going ahead and getting their full vaccination series or starting that vaccination series. That's the most important message of this. We have to get everybody vaccinated that's eligible for vaccine. And until we have vaccine availability for those children who are under the age of 12, we must wear a mask so that we can protect our children from becoming sick and becoming severely ill, requiring hospitalization.
Beth Sullivan from the Austin Chronicle. How, if at all, does Stage 5 of APH's COVID-19 risk-based guidelines inform the city's guidelines for large in-person events, whether they're indoors or outdoors?
The guidance that we're providing is essentially using what we know is going to be effective at combating the spread between people. And that is social distancing, wearing a mask to prevent aerosolized infected particles from entering our respiratory tracts, and vaccinations. And our risk-based guidance takes into account what the risk is based upon the level of community transmission at any given stage and what is assumed as the density or the proximity that people have with one another based upon whether they're vaccinated, unvaccinated, or partially vaccinated, or high risk in either of those categories.
My question, CBS Austin, what role did mass gatherings a month ago, like the 4th of July, play into the current surge?
At this point, we're still evaluating the data. In surges past, there's been a lot of spread that occurs actually in settings that are not necessarily large gatherings, but in settings where people are meeting with people that they know and love. We've had clusters that have occurred at birthday parties, and we've had some clusters that have occurred in strength and conditioning camps and volleyball camps. So it's hard to say that it's all because of any one thing, but it's a culmination of all of those opportunities where people are gathering together and someone is infected and there's somebody that is able to be infected in the crowd of people that they're associating with.
We go back to Molly Oak with KView. The state denied Cattrack's STAR request for more hospital staff to help with the surge. How many staff members were requested, and how do you plan to fund more staff?
That is an ever-evolving conversation. While I do not have the specifics of the numbers of staff that were requested in front of me, because from what I understand, each hospital individually submitted their requests directly to CATRAC. What I can say that it is of the top of mind of Dr. Walks, myself, and the leaders of the city to figure out how we can support our hospitals, whether it be looking into ways to use the FEMA reimbursement process or availing the hospital partners to special contracted rates to make it more affordable for them. So right now we're looking at a variety of options to help support their needs.
From KUT, do you have any advice you'd like to share with people planning to go shopping this tax-free weekend?
Go ahead.
I think we're going to say the same thing. Mask up. You know, mask up. That's the best thing you can do to keep yourself safe during this tax-free weekend.
From Community Impact, has there been progress to create more access to testing for the Delta variant should people feel concerned about which strain of COVID they might have?
So I'll jump in. We've expanded testing. The COVID test is there's varieties of COVID tests, but they all are testing for whether or not you have COVID. To get tested for a Delta variant would not be any of the tests that are available in our community. You would have to you get tested first, and then the process of identifying whether or not that's a Delta strain or not is a whole separate process. So our message is, if you think you have COVID, get tested. The way that you would be treated, the way that your treatment process and the infection control measures that you would need to take on after the test or before the test if you think you have COVID are the same. And so it's very important that if you think you have COVID, you need to get tested.
Eder Austin, should vaccinated Austinites still dine indoors, or should restaurants shut down indoor spaces voluntarily?
Vaccinated Austinites should consider their risk and assess where they're going to be in the indoor setting. They can make an assessment of whether or not an establishment is using best practices regarding COVID mitigation with distancing and availability of hand sanitizers, whether staff are wearing masks. Some establishments may be inquiring about vaccination status. All of these things would be ways that you could assess whether or not you're in a place where they're taking heed of what is being asked, which is that we do all that we can to stop the spread of COVID. The least risky scenario is going to be one where those things are taken into account, and ultimately, if there's good ventilation, outdoors would be if you're assessing ventilation, being outdoors is where ventilation would be best. However, if there are those measures being taken in an indoor venue and you're fully vaccinated, wearing a mask except while eating and drinking, you can make that assessment on a personal basis.
Fox 7. Will the authority consider a door-to-door campaign to reach out to people in areas with low vaccination numbers or high infections?
At this point, we are already doing door-to-door information campaigns. A lot of it's been led by Constable Morales and other ESDs in our community, and I'm sure that Cassie can speak more to that.
Definitely, we are trying to employ every avenue we have to promote the availability of vaccines. It's very important that people know, and they're at the neighborhood level, where they can get access to vaccine. It's also really important that as we reach out, that we tailor our message to address some of their concerns. So we definitely are working with key community leaders, those that are more in tuned to individual needs, to make sure that we are addressing their concerns so that we can assist individuals in making that individual decision to make the vaccine, and also that they understand the importance of getting the vaccine.
Telemundo. Are unvaccinated teens more likely to spread COVID-19 than other age groups? What is the danger to families from unvaccinated 12 to 17-year-olds?
If an individual is not practicing those things that mitigate spread, social distancing, mask wearing, hand washing, and avoiding crowds, staying home when they're sick, that's going to be what is causing more spread. And we've seen that in our adolescent population, that when we go back and do case investigations, more often than not, we're not identifying a place in class setting where there's been transmission between students. It's usually off campus, extracurricular, because the schools have done a good job of trying to enforce that and those measures. So having said that, if they are going to be a part of the solution in this effort, it's going to be really key for us to engage them as ambassadors for that age group, and those that know what their part is, those adolescents, teenagers that are leaders in their groups in their schools, I think can be a really important part of us getting the message out, and they can model and be examples for other people in their age group. With regards to
sorry. Who was going to speak? I'm sorry, I interrupted somebody.
That was me, but I'm good. I'm done.
Sorry, it was a question about school buses. How, as far as I know, schools are going to be school buses will be at full capacity. How likely is transmission slash dangerous is that to unvaccinated kids?
We know that transmission is increased with proximity between individuals and in situations where ventilation is not as good. So there are guidances that have been posted by the CDC and that are being followed by our school districts. There will be masks required on buses, and windows will be cracked to improve ventilation, and spacing will be made between the riders on the bus to help mitigate spread in buses that our children are using to get to and from school.
What are APH's plans, new ideas, potential to meet the coming challenges without the power of mandates?
Well, our biggest asset is our community. Our community has proven time and time again that they understand that if we follow the science, that we will be able to decrease the number of cases. And that's what we've done before, and that's what we're calling for right now. Again, I understand the frustration of having to put a mask back on, but we have a variant of COVID-19 that requires us to do so. We're seeing viral loads in both vaccinated and unvaccinated people that are high, and we can transmit this virus between individuals and spread to one another at the rate that we spread chickenpox, for instance. So masking will stop the spread, and vaccinations will stop people from becoming sick and developing severe illness, requiring hospitalization and ICU care and death. We know that vaccines have worked. We have senior citizens in our nursing homes who've gotten sick, who've been vaccinated, and they are experiencing, for the most part, very mild illness, not requiring hospitalization, and they are recovering from this illness. So if we can continue what we know has worked before and really step up our vaccination efforts, we can get the curves flattened and continue on with rebuilding our economy and letting our children have an in-person classroom instruction during the next year.
And we have
Both-
time for one more question. Sorry about that.
That's all right. Both Pfizer and Moderna this morning, in fact, are talking about the booster shots that they are testing. How quickly could APH roll out booster shots if they're given EUA? And what would that look like? How do you discern between the people who've gotten their full doses and who haven't, who are eligible for what dose?
I absolutely can answer that. We have plans to address boosters. It's an ongoing process. When vaccine started rolling out, boosters were already part of the conversation. And so we've done a lot of practice in rolling out boosters. We have ways of considering if an individual is eligible for a booster or not, because we would have access to their vaccine record and we could verify which vaccine they had. And based on the recommendations from CDC, we'd be able to follow whatever those recommendations are. At this point, from the booster guidance, we don't have yet whether or not if you received Moderna, if you could get the Pfizer booster, or whether or not you've received Pfizer, if you could get the Moderna booster. So we just don't have that guidance yet, but when that comes around and then the booster recommendations come out, we would be applying that to our clinical operations.
Thank you very much. And I appreciate having our pool reporter from CBS Austin. We are going to have to cut this a little short. I know we didn't quite get to everyone's question, but I would like to give everyone a chance with closing remarks. Very briefly, we have that 1 o'clock hard stop. So Dr. Walks, any closing comments?
I'd just like to say that this is our Olympic moment as a community, Austin. Earlier this week, we saw a time when a runner got distracted, fell, caused another runner to fall, and instead of going on and trying to finish the race, the runner that was tripped paused for a moment, thought about what a superhero would do, and picked the person that tripped him up. And together they ran arm in arm to the finish line. We have to do this. We have to pick each other up, get vaccinated, and work together so that our businesses can thrive, the music can play, and our children can play and go to school in person safely. Thank you.
COVID changed the game, but we can too. We can beat a single cell organism. We can survive. Wash your hands, wear your mask, watch your distance, get vaccinated.
And I'll just round it out again. The vaccine works. It is the best tool that we have in our toolbox to combat this combat this disease. And if you haven't been vaccinated, think about this opportunity to take to protect your family, protect your children who cannot get vaccinated yet, and protect others. Again, this is a personal decision, but a personal decision that affects so many more people. So this is an opportunity for us to stand up, like Dr. Walk said. This can be our Travis County, City of Austin Olympic moment. Let's get this done.
Thank you very much, everyone. This concludes our press conference. I want to thank Dr. Walks, Interim Director Stirrup, and Director De Leon for joining us today. For the media, if we did not get to your questions, we really apologize. Please be sure to send those to the media inbox or reach out to us on the media line. Thank you very much, everyone. Please stay safe, get vaccinated, wear a mask.